Hello, my name is Rich Capadagli, and I want to welcome you to the Star Health Judicial presentation for the Superior Health Plan. Superior Health Plan provides healthcare for Texans enrolled in Medicaid, CHIP, Medicare, and the new healthcare marketplace exchange. Currently, we're serving over 960,000 lives statewide. We became the first organization in the country to serve as the state's exclusive managed care company for children placed in foster care. That was as of April 1st, 2008. We share our expertise nationwide. We have 4 sole source states: Texas, Mississippi, Florida, Washington, and 6 multi-source states: Missouri, Louisiana, Kansas, New Hampshire, Indiana, and California. We were awarded the Star Health contract renewal as of September 1st, 2015. A look at our quick guide to Star Health program enhancements for DFPS staff. And you can see that beginning September 1st, 2015, Superior Health Plan was able to provide enhancements to the Star Health program. This means that Star Health members can receive extra services like the ones listed below. We have an expanded vision benefits, including unlimited eyeglass replacement if lost or broken. This includes unlimited eyeglass replacement if lost or broken, and expanded vision benefits provided prescription glasses or $100 toward the cost of any features or frames not covered by Medicaid. If you remember, if you were around back in the day, I guess it was, you could probably remember a time when children in care received 1 pair of glasses a year, and if those glasses were broken, they could not receive another pair of glasses until the year expired and they re-upped on being able to get another pair. No longer is that true. Now kids can have new glasses whenever they need it, and for many children who want to stay away from the Medicaid type frames and want to get more designer frames, they're able to do that with $100 toward the cost of those features. We also have over-the-counter pharmacy services. That's new for this year. It's $30 every 3 months for over-the-counter medications through a mail order program. We also have care grants, and those are small cash grants for items like art supplies, clothing, or other personal items. We have an A2A Cent account rewards program, and what this does, it offers reward dollars to members who complete wellness visits, dental checkups, and other health screenings. It's targeted for members ages 18 through 21. Traditionally tough group when it comes to keeping them on track with their visits and such. We also have Boys and Girls Club memberships now. The Boys and Girls Club memberships are for ages 6 through 18, and that can be set up just by calling us at Star Health and making the request for your region. We also have sports and camp physicals we're now covering. This is for members age 4 to 18. And the important thing to remember about this is in the olden days, back in the day once again, you had to coordinate your annual physical checkup with all that of camp physicals, or as a foster parent, you'd be paying out of pocket. This way, we're able to cover sports or camp physicals in addition to your annual checkups that you do. We also have behavioral health 7-day follow-up program. Now, those are for kids that are discharged from the hospital. We're able to have an age-appropriate incentive, usually a little gift card or a teddy bear for when the child makes it to their, we follow up, and within their 7-day follow-up appointment, makes it to their 7-day follow-up appointment, there's a little present waiting for them, so that's kind of nice. We also have the online mental health services or mental health resources, and this is online training opportunities. In addition to the online training opportunities, Star Health members also have access to www.mystrength.com, which is an online resource to improve mental health and overall well-being and functioning, available for members, caregivers, and caseworkers. Also, we have case-by-case services. These are support services that are available to members when the case needs are identified. This could include many different things, including trauma-informed peer support for caregivers, practice visits for gynecology and dental appointments, arrangement of prior authorized non-emergent transportation to new placements, costs covered for professional assembly and disassembly of durable medical equipment, provision of identified skilled nursing, um, also transportation and new placement of non-emergent ambulance transport, provision up to 48 hours observation stay in inpatient setting when placement or support services are not immediately available following discharge. We also have Health Passport, and this is in addition to our standard web browsing. Star Health members will also have mobile Health Passport access. And we also have mobile crisis outreach teams. These are available through the statewide local mental health authorities. And in addition, Star Health mobile crisis services will be available in Houston, Dallas, San Antonio, Lubbock, Corpus Christi, specifically for children placed with pathways or covenant kids. Also, we have the Psychiatric Hospital Diversion Program. This originally started in Tarrant County. It's now been expanded to San Antonio, with further expansions planned for Houston, Wichita Falls, Abilene, San Angelo, Midland, Odessa. Centers for Excellence is another medical clinic that we have set up in Dallas and Houston right now, but it's going to allow for specialized foster care clinics that have expertise in working with child welfare and with trauma-informed care for the kids that go there. As far as your Star Health interactions, you can see the number here is 1-866-912-6283. This covers your general health screenings. Also your service coordination and service management, as well as your ad hoc opportunities. When it comes to general health screenings, welcome calls include overview, Texas Health Steps, medical dental checkups, general health screenings, and community resources. General health screenings identifies healthcare needs and triggers referrals to service coordination and service management, disease management, or specialized programs. GHSs are also completed within 30 days for all new Star Health members, and the placement changes trigger completion of another general health screening. As far as more specifically regarding the service coordination and service management options, service coordination is telephonic support for coordinating ongoing health care by a bachelor's level staff or social worker, someone who can help connect you to resources, such and so forth. And then service management services are actual clinical case management by a registered nurse and or a licensed physician, clinician, to help with all your service management needs. We also have specialized programs, including clinical case management for members with specific diagnoses and or high acuity needs, including complex case management, transitioning youth programs, discharge planning for members who are inpatients, Start Smart for your baby program for pregnant members, transplant specific programs, diabetes, dual case management, smart nutrition and activity program, and personal care services. With disease management, we have an ongoing clinical support for members diagnosed with asthma and or intellectual developmental disabilities. As far as the ad hoc opportunities, we have Impact Pro as a predictive modeling tool that's used. It's member service calls. We're able to do psychotropic medication utilization reviews, as well as nurse advice line follow-ups and ER utilization follow-ups, as well as DFPS individual case staffings. Now here's a checklist that you can look over. This is a kind of enables you to see the questions that may be asked and what each of these questions means, so that you can better get these questions answered. You can see that it comes under the headings of unknown health conditions, concerns about health conditions or diagnoses, frequent placement changes, medical or psychiatric hospitalization admissions, frequent trips to the ER, going out of state, what you need for that, psychotropic medication concerns, any kind of unknown medical histories, and for any children that are turning 18 soon. As far as the Star Health process, many times when you're seeking services for your children, there are going to be barriers that occasionally come up, and we have ways to make sure those barriers are able to be overcome and you're able to get the needs met for your child in question. And the way this breaks down is that caregivers have the opportunity to follow up or report Star Health barriers to their DFPS caseworkers. DFPS caseworkers, in turn, are able to go through their regional well-being specialist with any barriers they've encountered. And of course, our regional well-being specialists are able to escalate those inquiries regarding those barriers to a Star Health liaison for internal review. Then, of course, once the issue is investigated and we figure out a way to fix the barrier or get rid of the barrier that's preventing care from being achieved, then the Star Health liaison reports back to the FPS regional well-being specialist, and so on and so forth as it trickles down to the caregiver in question who had the original concern. Here's some case scenarios that are laid out in front of us. We have Medicaid covered services. This can be accessed without a court order as long as they're medically necessary. Services that are not medically necessary cannot be paid by Star Health. And if services are needed with a specialist, a referral can be required by the primary medical provider, the PCP. Non-Medicaid covered services are not covered by Star Health. Care grants, value-added services, case-by-case services can be considered or may be considered if appropriate and do not require a court order. Court-ordered non-Medicaid services become the financial responsibility of the FPS. When it comes to orthodontics, they must be medically necessary for Star Health to pay for those. To begin the process, the child or youth must be seen by their dentist and receive a referral to the orthodontist, and the orthodontist must complete an evaluation to determine if the services are medically necessary for Medicaid services to be covered. When it comes to placements, placement is not a Medicaid covered benefit and cannot be paid for by Star Health. Placement considerations must be secured through DFPS. Caseworkers must contact the regional well-being specialist to begin the court-ordered placement process. Here we have some judicial points of contact. You can see each of the trainers, including myself in Region 1, 2, and 9, are listed here. And so if you have any further comments, questions, or concerns, you can feel free to reach out to us. Or if you'd like an expanded version of this training or any other trainings that we offer, you're able to do that by calling us and getting those scheduled directly. That brings us to the conclusion of this training. I want to thank you for the time you took in listening. And if you have any further questions, you can reach us at Member Services or at the numbers listed previously. The number for Member Services is 866-912-6283. Thank you much.